أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين صدق الله العظيم. I pray the Surah Fatiha with the intention of bringing cure and shifa to all those who are currently unwell as a result of COVID-19 and other illnesses, and also as a source of commemoration for those that have sadly passed away. Inna lillahi wa inna ilayhi raji'un. May Allah subhanahu wa ta'ala bless their souls. My name is Kamran Shazad from the Bahu Trust. I'd like to welcome you all today to this very needed and much anticipated webinar. Before we begin, I'd like to go through some very brief webinar housekeeping rules. Just letting you know that this session is being recorded and it will be sent out to all the registrants in the next few days, inshallah. We'll start off with a few speakers and then we'll move on to the question and answer session. There's also a very informative presentation from doctors on the vaccination itself. It's very important that you don't miss that. If you have any questions, please put them in the question and answer section that you have somewhere on your screen, depending on whether you're on a laptop or your mobile phone. We already have a huge amount of questions that have been submitted. Please don't be offended if I can't get through all the questions. Please bear with this poor soul here because I have to host the webinar and I have to filter through all the questions at the same time. If you do submit a question, please keep them brief. I won't be able to read lengthy questions quoting detailed research, etc. Not because I disagree with you, but purely because I won't have time to read such a lengthy question. The webinar is aimed primarily at a Muslim audience, and I appreciate that we have non-Muslim participants. So if we use any words or terms which you don't understand, please ask them on the chat section. And other people will help you understand that. And I mentioned a chat section. Please don't put your questions in the chat section. By all means, put your comments on there to generate a conversation, but please don't be offensive or abusive or say things which can be taken badly. Okay, so moving on now. The purpose of this webinar is not to tell you to take the vaccination or not. Now, the Bahu Trust doesn't take a policy position on the vaccination. It's the right of every person to choose for themselves whether they get vaccinated or not. You know, it's a key component of the NHS and the medical practice as a whole that people are entitled to consent to their own treatment. You know, however, we are concerned that there is so much misinformation out there that it can be confusing. And in quite a few of the cases, that information can be false and dangerous. Equally, there's so much information that it can go way over people's heads. And we understand that people have lots of legitimate concerns, and we wouldn't be true to ourselves if we didn't ask these important questions. And so the point of today is for you to hear directly from trusted members of our community and to be able to ask questions that you feel are important to you. And whilst we're here, I'd also like to address another matter. We have not organized this webinar because we feel Muslims are anti-vaxxers or because it's the Muslim community that is holding back. You know, we're doing this webinar because our primary audience is Muslim and that's who we speak best to. And so we're doing our part, just like other people are doing theirs in their respective communities. But I can assure you that people from all sorts of backgrounds are looking for further information and, you know, they have lots of questions they want to ask. So we have with us an esteemed panel today to help us from a medical, a faith and a social perspective. They're all specialists in their own field of expertise. They're purely here for the sake of Allah and they're here to help people decide what to do. So, you know, moving on now. So let's go straight to our first guest, our first panelist. Hafiz Dr. Ather Hussain is a prominent scholar in the UK. He's well respected and speaks regularly about contemporary issues such as mental health, depression, fake news, social media. You only have to Google him or YouTube his name and you come across his brilliant talks. Now, Hafiz Saab, my first question, or my main question to you is, can you give us a general Islamic perspective on how we should approach this issue as Muslims? What does the Islamic faith tell us about vaccinations and medication?
Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen wal aqibatu lil muttaqin wassalatu wassalamu ala sayyidil anbiya'i wal mursalin amma ba'd faqad qala Allah ta'ala fil Quran fas'alu ahla zikri in kuntum la ta'lamun sadaqallahu lazim. Respected Brother Kamran Saab, respected guests, viewers, assalamu alaikum wa rahmatullah. A simple question, and this is the only reason why I'm on this panel. I am sure that, like our viewers, the questions regarding the vaccine, the nature of it, and whether we should really be taking it will leave in the capable hands. As far as Sharia is concerned, I just want to share 2 or 3 points, and I pray that people get a sense of, number one, the worth of Sharia in Islam and the clarity that it provides in difficult situations like this. And number two, it provides a clear guidance on what we should be doing in this time when we are not sure what kind of path to be taken. So I'm going to share 2 or 3 simple points. The first point I want to share is that what is for certain, what we call yaqeen, is that the COVID pandemic is destructive. It is fatal. I think the figures now are about 90,000 people who have passed away in this country alone. It's taken the lives of the young and old. It's severely affected our religious lifestyle. We haven't been able to commemorate Ramadan like we normally do. No to Eid, no Mawlid, no other important dates, no Mahafil, no proper Janaza, no Jummah, no Jamaat in many cases. So COVID is real. And as an Imam, it's very hard to say this, but the most common phrase we are using right now on the phone and through social media right now is Inna lillahi wa inna ilayhi raji'un. And our job has just become very, very difficult and quite emotional at this very, very difficult time. We are in a right turmoil. So that's certainty. This is what we call yaqeen. What is not certain and what is now classified as shak, which translates as doubt, is whether the vaccine is dangerous, whether it's part of a larger conspiracy theory, whether it is haram. And the first point I want to make abundantly clear is that shak, doubt alone, cannot overrule certainty. And certainty here is the death of hundreds and thousands of people. The second thing which is important is the verse from the Quran that I recited, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Ask the people of understanding, of knowledge, of intellect, if you don't know something. By human nature, we don't understand everything. I don't understand how Wi-Fi works. I don't understand how this Zoom works. I asked my girls to set this up. But it doesn't mean I can't take benefit from it. I don't understand how my car works. I give it to the mechanic and he looks after it. All we can do, and this is a spiritual quality, is to trust the people who do know about it. In this particular circumstance that we find ourselves in, it is the qualified doctors who are the people of understanding, of intellect. The NHS, who many times in my life and my family have put our trust in. This is on one hand, and then on the other hand, we have news from social media, which at most in Sharia is considered as doubt, when we don't know where the source is, where we don't know whether the information we have is real. And on the other hand, we have the advice from British Muslim doctors who are telling us that this is what the vaccine will do. This is what the benefits of the vaccine are. A lot of the time on WhatsApp and so forth, something which I've been against before the arrival of the pandemic is it's not sufficient in our religion to say someone authoritative has told me, or I've heard it from someone reliable. That doesn't cut it in our Sharia. That's not a dalil. In Islam, it's not what you say, it's who said it as well. That is so important. And in many respects, the credibility and the source of the knowledge is more important than what is being said. And WhatsApp messages, social media, I'm sorry to say, by its very nature, lack that kind of authenticity. Going back to the first revelation to Prophet Muhammad sallallahu alaihi wasallam, a story that I don't need to spend time on, is that Sayyidina Jibreel alayhi salam said to Prophet Muhammad in the cave, read, Iqra. And he said it 3 times. And the Prophet alayhi salatu wasalam simply didn't respond. And he said, Ma ana biqari'in. He said, I'm not going to read. And what Sayyidina Rasulullah sallallahu alayhi wasallam did was he only reacted the 4th time when Jibreel said, Iqra bismi rabbika allazi khalaq. To word it differently, when he only reacted when Sayyidina Jibreel explained who the source was. And that was Allah subhanahu wa ta'ala, read in the name of Allah subhanahu wa ta'ala. So the first revelation coming down to us was about authenticity. The final masla I want to explain, and I'll explain this as simple as possible. Imagine that Kamran, in his many nature walks that he likes to conduct, a man of nature, our Kamran is, imagine he ends up in a forest and it's salat time and he doesn't know which way the Qibla is. Kamran now is responsible to use his own intellect and work out which way Qibla is and to perform Salah. Now, if later he read in a particular direction and it later transpires that that direction was wrong, such is the compassion and merciful nature of our religion, that Kamran would not be responsible to perform that Salah again. It would be accepted. Same situation, Kamran's in the jungle and he comes across a local and he asked the local and he said, which direction is north, east, south, west? It is now, and the local tells him that you have to read in this direction. Kamran now, Sharia, in terms of Sharia, has to act upon what that individual says. He cannot act upon his own advice and he will be sinful if he doesn't. Even if it transpires later that the local told him the wrong direction, Kamran will not be responsible for it. So qiyas is only permissible in the absence of a greater evidence, and khabr al-wahid, what we call, is much greater than that. So our situation today is like the lone man in the desert. We are confused, we're not sure what to do. And in this situation here, we have to trust the person who knows which direction Qibla is in. And that is the doctors. And that is the NHS, which, let's face it, we put our trust in every single day, other than the pandemic, who have saved us so many times. So Sharia is very, very clear that you ask the people of knowledge. Sharia makes it clear that something which is authentic, something which is real, cannot be overridden by something which is suspicious and questionable in terms of authority and in terms of authenticity. Sharia is real, that you are not in any way religiously or morally reprehensible in any way if you act upon the advice of the doctors as far as Sharia is concerned.
Thank you, Hafsab. That was really helpful. And now that we've heard from a religious perspective, we'd now like to move on to a more social perspective. Our next speaker probably doesn't need an introduction. She's well known and well respected to many of us, both in the Muslim and non-Muslim community. She's a human rights campaigner and a staunch fighter for individual rights. It would be fair to say that if anyone had any concerns about any issues arising from this regarding rights, privacy, etc., then Salma Yaqoob would be the first one that would be standing up for our rights and would be fighting for the cause. Now, Salma, clearly there is a cause amongst many people about the vaccination. You know, we've heard it so many times. And from my conversations, that concern isn't always necessarily with doctors, the nurses, or NHS itself, but more so with corporations, pharmaceuticals, and I dare say, the government. Now, in your opinion, why are people not trusting the authorities? And what should we be doing to instill confidence in our community?
Well, assalamu alaikum, Kamran, and all the panelists and everybody joining this evening. And just to emphasize, I am speaking very much in a personal capacity. Of course, I have my own questions, and I'm not saying just because I've arrived at my conclusions everybody else should necessarily follow, but I think it is important that we address legitimate concerns. We don't demonize people just because they have concerns, and in fact many people who are called all sorts of names for questioning turn out to be right further down in history. But at the same time, it's about using our faculties to sift through what are unfounded claims and what are legitimate concerns. And your question was, why are people skeptical? And my answer to that would be, it's not so surprising, because sadly, in not so far off history, populations have been given false information or distorted information. And so it's not surprising that people are skeptical. I mean, whether it was the Iraq War, when we were told that we were 45 minutes away from being attacked by Iraq, and now, people are admitting there were no weapons of mass destruction. So we know that literally millions of lives can be impacted by statements that are made, which turn out to not be actually have been made in such good faith. And in Britain here, we know when the Brexit campaign was going, regardless of which side of the debate you're on, claims like, we're going to have £350 million a week given to the NHS, if we vote for Brexit, were made, and clearly that hasn't happened. So it's not that anybody who's questioning right now is somehow mentally deficient in some way. A healthy skepticism would be the natural response to some of the political steps and proclamations that have been made, by people really who should have known better. But that doesn't mean then that we kind of go so far that we throw out the baby with the bathwater. That'd be my personal take on it. Some people are even questioning whether there is even a pandemic. They're calling the whole thing a hoax. And I can tell you, as somebody who does work in the NHS, I work in the mental health service, and my own eldest son, he's a final year medic, father of my children, he's a doctor. It's real. The hospitals are overwhelmed. Talking in our community to like funeral directors, we are so overwhelmed just this week that funerals are having to be delayed because people cannot cope. So, as you pointed out, and as our respected Hafiz Ather Hussain pointed out, this is something the community is facing on a daily basis. Inna lillahi wa inna ilayhi raji'un is all over, my WhatsApp groups, from Allah we come and to Him we return, because so many of the wider community, but specific within the Muslim community itself, the BAME population is being disproportionately impacted in this, whether it's Black communities or Asian communities in terms of Pakistani and Bangladeshi communities. The number of deaths, the number of serious illnesses, the number of people requiring ventilation is a fact. That's not something that's in dispute. That's not something that's a political debate to be had. What is debated is what should we be doing about it. And from my own perspective, living next door to my mom, who's in her 70s, who generally, mashallah, alhamdulillah, is in good health, we have been very determined as a family that we shield her, that we observe the social distancing. When masks were being questioned, it was like, in our family, no, you wear those masks. And now that the vaccine has become available, is to take the vaccine. Because yes, whilst it's true that statistically those people who get COVID, if you're young and don't have if you don't have underlying health conditions, the likelihood that you're going to suffer something very serious may not be high. But that actually changes drastically when it comes to our elders and people who are more vulnerable. And people who are of Pakistani, Bangladeshi, African Caribbean background, when it comes to diabetes, when it comes to heart conditions, already fall into those categories. We have got health inequalities going back years. The pandemic has only exacerbated, it's kind of exposed those issues. So for me, we're kind of almost in this contradictory situation. It's a sense of great sadness as well as pride that the first 10 doctors who died working at NHS on the front line to help people with COVID actually then contracted COVID and died from it were Muslim doctors. We don't see that kind of highlighted so much in our own communities, or even indeed in the wider communities, and sadly, often BAME communities are made scapegoats. You know, we had all the stuff around Eid, that Eid is going to cause the pandemic to spread. And, you know, we were told a few hours before, right, Eid is cancelled. But then we see the kind of double standards when it came to Christmas, that they actually eased sort of the measures around lockdown, around, you know, the bubbles, when we knew that the pandemic was already underway. So I think the messaging has been blurred. Confusion has arisen because we have seen certain contradictions coming right from the top that hasn't helped. But I think by and large, when it comes to the grassroots communities, people have abided, people have followed, perhaps to the surprise of many leaders, you know, how people have respected the rules and are determined to safeguard the vulnerable and elderly. But sadly, because of recent political events, and even historically, where it's sad but true that Black people and Asian people have been experimented on, you know, whether it's a famous syphilis case where between 1932 and 1972, you know, syphilis was allowed to rampantly take hold within the African Caribbean community. They were told that they were being treated, whereas actually they weren't, in order just for, you know, medical information to be garnered. We can understand why there is some skepticism, some fear, you know, that's genuinely based on experiences, not just something that's, you know, taking place in people's heads. But what I would argue now is that we do live in more transparent times. We have a free National Health Service. Any negative consequences are going to be borne by the National Health Service. And whilst historically manufacturers who produce vaccines have been given indemnity, you know, I don't agree with that on a business model case. But we have such a model when it comes to our banks, where they are in effect indemnified. The public sector stepped in and saved the banking sector when it was, you know, some of their actions which may have caused a lot of economic grief. But that for me is separate from the health risks, and I think it's important not to confuse the two. And on balance, you know, from listening to what the scholars have said in terms of the content of the vaccine, the fact that I know about the regulations that have to take place and have taken place when it comes to these vaccines, that there's absolutely no way that we are being hoodwinked about it. There are people all over this country and around the world who are part of this initiative. So that, you know, in terms of any great conspiracy to be foisted upon the population, I don't buy it, both from a kind of scientific perspective, but also from a political perspective. It absolutely makes no sense and would not hold water. You know, we've already seen the kind of uprisings that are taking place, you know, in places where people would have even expected. The fact that there could be such a conspiracy on this scale simply is not tenable. And so, yes, that nobody on this panel can give 100% guarantee. Any medication you take, even whether it's paracetamol, you'll have, you know, on the prescription, on the details, here's some potential side effects. And I fear that some of the potential side effects are being overblown or being misrepresented in certain things that I've seen on WhatsApp. And I think on balance, given the potential gain to be had, and for it to really be working, we do need 75% of the population taking it up, which by the way, is less than the 95% uptake needed for measles, for example. And all the same issues that people were scared about with measles, with polio, with smallpox, you know, they were understandable, they were real. But we've seen actually how vaccines have changed the world, have saved millions of lives, and whatever downside there has been far, far greatly outweighed by the upside and keeping people safe. So on a personal level, I would certainly advocate erring on the side of caution. And for me personally, in terms of me and my family, that would be supporting the uptake of the vaccine, having seen the information that we have to date. And I trust that the professionals that we are listening to, and again, it's important, I think Hafiz emphasizes very beautifully, that it is about looking to people of knowledge and the actual expertise in those particular fields. So just because I may have some expertise in one hand doesn't give me an expertise in another field, and vice versa. When people have that expertise in whether it's respiratory medicine, in immunology, in vaccines, and I see on the panel we have, you know, experts. They're not here just because they happen to be Muslim speaking to a Muslim audience. They are respected experts in their field who are maintaining their conclusions on balance on real evidence. And I personally, in my conversations and my assessment of that, I'm convinced that it is the right thing to do, and it's something that we should be encouraging. And time is of the essence. The sooner we can get this, the sooner we can reach a level of immunity and protection, which makes it easier to come out of these kind of recurring lockdowns. And the other negatives that we will be seeing, mental health pandemic, the economic consequences, which will also have a knock-on effect on health, should we not take all these measures seriously. And lastly, with or without the vaccine, we still need those basic public health measures on social distancing, on washing hands, those things which have already helped in countries like Taiwan, where they have a great trace and track and isolate and support mechanism. We still need to be doing this, because even with the vaccination rollout, the other responsibilities don't suddenly disappear. So I'll stop on that, because I'm conscious that we have a panel of experts who I think it's important to hear from.
Thank you, Salma. Thank you for summing that up really well. And I know as a mosque here, the Bahu Trust, we being one of the major and the bigger mosques, we have held so many funerals and janazas in the masjid. I think we did 5 in 7 days only last week. And in the 35-year history of the Bahu Trust, we've never had to do that many, especially in such a state. So we can see the testimonies in our eyes. We're seeing all this happen. Okay, so now over to our main presentation of the evening, and to give us more details about the vaccinations itself, we have with us Dr. Adeel Riaz, who is a COVID-19 specialist GP, and Dr. Samira Afzal, who is an infectious disease specialist. And they're both based in the West Midlands, and we're honoured to have them with us today. They're part of the British Islamic Medical Association, also known as BIMA, and they've been doing some fantastic work in getting factual and unbiased information out to communities and focusing on myth busting. So what I'd like to do now is hand over to Dr. Adeel and Dr. Samira for them to deliver their presentation.
Assalamu alaikum, Brother Kamran, and assalamu alaikum to everyone. Bismillah, alhamdulillah, wa salatu wa salam ala Rasulullah. Me and Dr. Samira, we have been working with COVID in Birmingham area for a while, so we've got a fairly good idea about the situation, what's going on locally. And us, the frontline physicians, actually relish these type of opportunities, because despite all the advancements we may have in the treatment of COVID, it's still better not to get this disease. There's still lots of people dying. So these type of opportunity arranged by Brother Kamran and Bahu Trust are excellent opportunities for us to speak to our local community members. And if we are able to save inshallah one unnecessary death, then I think this would be the whole effort worth paid for. So like Brother Kamran said, me and Sister Samira, we are both physicians here, and we are representing British Islamic Medical Association as well. So BIMA, we'll give you a brief introduction of BIMA, and then we'll be briefly talking about COVID, because without actually knowing much about COVID, it's difficult to appreciate how important the vaccination is. And then we'll briefly talk about vaccinations before we go to Q&As. I understand that the main gist of the day is to have questions from our audiences. So BIMA, British Islamic Medical Association, was founded in 2013. So we have got 4,000 plus Muslim healthcare professionals who are our members, which is a huge number. It involves doctors, nurses, physios, all sorts of. If you're in the healthcare sector and you're Muslims, you're welcome to become our members. So alhamdulillah, we are about 4,000 now. It's all volunteer-led, funded and delivered by volunteers. We do not get any funding from NHS, local authorities, public health, or any other bodies of any sort. It's important you may have heard rumors in the media these days about the funding, wherever it comes. We actually all pay for from our own pockets and give our own time for this great cause. So our vision is basically to unite and inspire our members in service of our patients and our profession. And BIMA has done plenty of health promotional campaigns. You can read more about BIMA or by visiting our website. Even before COVID, most of you might have heard about BIMA. We've done health fairs, we've done community awareness activities, Hajj and Umrah seminars, and most importantly, our actually the Lifesaver course, which BIMA doctors have actually initiated, and it's copied all over the world now. It's happening in more than 30 or 40 Muslim countries, this Lifesaver course. So there are plenty of activities, and this is done by brothers and sisters who are part of this great organization. So on behalf of BIMA, obviously we are thankful to Bahu Trust to give us the opportunity to talk to you today. So going to the next slide about COVID itself, the current situation. Yeah. Well, you hear that on the media. So this is today's latest data. So in the UK, we had 3.4 million cases so far and almost 90,000 deaths. So these are the deaths which are probably the most careful estimation of the total number of deaths. So the ONS reports the actual deaths might be even more than this. It's obviously most of them are in England, but Wales and Scotland proportion-wise are no different. Next slide, please.
That's great.
So the current COVID status nationally, I mean, because these are Monday's figure, and Sunday and Saturday are historically a bit better. Because of the data collection issues. So we shouldn't be fooled by the daily deaths of 599, which is still a huge number, but average we are actually going above 1,000 or 1,200 as an average. And in the last 7 days, actually 7,900. It's such a huge number that has sadly passed away. And worryingly, the patients who are admitted in hospital, the numbers going up and up. We have not seen yet a downward trend in the hospital admissions, although we are into the third week of the lockdown. And me working in Birmingham as a frontline GP, I've been doing this COVID-19 service since March, since the pandemic started. And this is the third lockdown now. And in this specific lockdown, we have still not seen the patient numbers going down. Usually in the previous lockdowns, after a week or two, the patient numbers would go down. But this time it's just up and up, and today was such a busy day as well. It's all the appointments are full, and people are more sicker, and they are getting more younger and younger as well. Now we're not seeing 80s and 90s now. We are seeing people in their 30s, 40s, and 50s who are really unwell coming to us. So situation in Birmingham is no different. So Birmingham is still in top 10% of the areas in Birmingham in the country. Go to the next slide now. So, well, this was some picture we want to show, the Airbus. Sometimes to understand how big the numbers are, Airbus A380, some of you might have sat on this one when you travel to Dubai on Emirates airline. 800 people sit on Airbus A380. And you can imagine two Airbuses colliding with each other on the skies of Birmingham every day these days. This is how huge the numbers are. So in Birmingham, if you see at the bottom of this graph, we are actually this shows that we are in the red area, far above average. 8,267 cases in Birmingham so far, and the weekly deaths are quite high. So 1,785 people have sadly passed away in Birmingham. All of our local hospitals, be it Heartland, Queen Elizabeth, City and Sandwell, they're full. They're almost to the capacity in their intensive cares. And sadly, actually, in some of the hospital, I was speaking to someone in Heartland's hospital, 90% of patients admitted are from ethnic minority communities. So it's affecting everyone, but unfortunately, our community is definitely more affected. So I'll pass on from here onwards to Dr. Samira, who infectious disease, if you know about infectious disease, this is the department that deals with viruses and bacteria and infections. So we're fortunate to have Dr. Samira in British Islamic Medical Association in our panel member today to guide us a bit further about the disease and the local situation here. Samira,
Jazakallah khair, Brother Adeel. So, Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. And I wanted to start off by thanking everyone for being part of this exercise in seeking more knowledge and clarifying things to achieve the best outcomes for our community, inshallah. And before I move further, I'd just like to request everyone for a minute to please recite dua tonight before going to bed, because in each of these numbers, the total of 8,200 plus patients, the 14 people who seem to die at least on average on a daily basis in Birmingham, is someone's father, someone's mother, someone's sister, someone's brother, and some of my patients who left behind 4, 5 school-going children and succumbed to COVID-19. So COVID-19, by now, everyone already knows what it is. It's a member of the coronavirus family, and there are 2 main routes of transmission: droplets, which we try and wear masks to minimize, and the second route would be direct contact with a contagious person or even a contaminated surface. So we may be wearing our masks, but we don't know when we go to the supermarket who has picked up that packet of vegetables before us and whether or not there is any residue on that plastic, hence the need for continual hand hygiene. Although I'm sure you can appreciate there's only so many times sometimes we can remember to wash our hands. Now, towards the end of 2020, the UK got alarmed with news of a new COVID-19 variant. So this was basically a new mutant of the virus. And generally, we know that viruses have a habit of changing over time. Now, this particular change or mutant of COVID was modeled to be up to 70% more transmissible. So that means that it spreads even quicker. And certain places like Imperial College London, and you could check this online, have conducted further studies looking at things and realized that actually with the new strain, a greater proportion of young people, even those younger than 20 years old, seem to be affected. So this is a little infographic drawn by one of my colleagues in BEMA, which shows the impact of this new strain in terms of death rates. So a normal COVID-19 strain, if 10,000 people are infected, after 1 month of spread, there are 129 deaths from new cases. Now, the new strain, even if it was just 50% more transmissible, so not even 70%, which is what was originally modeled, even at 50% more transmissible, if 10,000 people are infected, after a month, 978 deaths from new cases can occur. Now, the COVID-19 patient in hospital, this is something very close to my heart, which I wanted to share with yourselves, and I thank Bahu Trust for giving this opportunity. The COVID-19 patient in hospital actually embarks on a rather scary and lonely journey. Often their relatives are very frail as well, and patients actually ask me not to let their relatives come in because they're afraid that the elderly wife or elderly mother or wife with comorbidities may end up getting COVID as well. So when patients come in, there is an air hunger, just the need for more oxygen because of the damage which the virus does to the lungs. And the nurses run around to try and give the person as much oxygen as possible, as you can see through this mask here. At some point, we reach the maximum amount of oxygen which can be delivered via mask. And that is when some people, if they can tolerate it, move on to receive oxygen via this particular device known as non-invasive ventilation. So this is something which is strapped onto the person's face. There is a seal here, which nurses try their best not to allow to irritate the skin too much. But it is absolutely important that the seal is good so that lots of oxygen can be pushed into the person's lungs. And patients have described it to me as almost like putting your face out of a car window when it's driving at 120 miles per hour. So it is something which is really challenging. I have a lot of respect for people who try and tolerate it 24 hours a day, because I would certainly struggle. Now, due to the mask having to be on 24 hours a day, the moisture from person's own breath can actually cause skin irritation. And this is a picture of a person who has had some element of skin irritation because of that mark on them. And nurses have tried their very best to avoid this, but when the choice is between skin irritation and optimizing and trying to save someone's brain, you can imagine what the patient themselves would prefer. And finally, when even that does not work, or some patients are just simply not able to tolerate that mask, they end up being intubated in ICU. As you can see, lots of machines, lots of bleeps. It is a very emotional experience doing ITU ward rounds. I have done rounds where my patients have been in their 40s, 50s, and Quran just going on throughout ITU, and not many survived. Those who did have an element of post-traumatic stress disorder. So please do remember them and their families in your duas tonight. Throughout this pandemic, we've had a hard time in Birmingham, actually. There have been times when the Muslim cemetery's been full. There have been times in the UK when we've been worried about the oxygen supply situation because the pipes are not big enough to actually deliver the oxygen. And I know that I've missed a slide here, but what I would request you to remember is that COVID-19 is a killer. Do not underestimate it. Seek information from trusted sources, because fake news harms, and you are in control of your choices, which is why we are all here tonight, this evening, to discuss this and get more information. So if someone to ask me why COVID-19 vaccination, this would be my answer. Because vaccination prevents symptomatic COVID. In turn, there's less virus spewed out, and in turn, that prevents death. It's almost like a parachute out of the situation, out of a air crash, we hope. And certainly if na'uzubillah, I'm ever in a plane and it's crashing and someone's giving me a parachute and somebody else tells me, don't take it because it's fake, I would want to be definitely sure and get as much info before I refuse it. So BIMA has issued position statement on both the current vaccines, Pfizer and the Oxford AstraZeneca vaccine. These are available on our website and you can Google them. And of the COVID-19 vaccines in the UK, we have got the main ones out at the moment are Pfizer and Oxford AstraZeneca. So Pfizer is an mRNA vaccine, and actually the first mRNA vaccines were developed about 30 years, in 2003, mainly for rabies, but obviously rabies is not a public health problem as big as COVID. The Pfizer vaccine had 44,000 people in trial. 2 doses are about 95% effective in preventing symptomatic COVID. And in the initial trials, of the 44,000 people who had it, 2 people had anaphylaxis, and these were people who were known to have had anaphylaxis before, which is why the current guidance is very careful in recommending vaccines for people who've had anaphylaxis before, and it's a risk assessment, and often these people end up getting AstraZeneca vaccine. The AstraZeneca Oxford vaccine is an adenovirus vector vaccine, so it's basically the adenovirus vector technology has been used for various other vaccines which we received. More than 11,000 people in the trial, about 70% effective according to current data. And there was 1 case of transverse myelitis. So for our non-medical colleagues in the audience, this is a type of nerve problem just thought to be maybe linked to the vaccine, and the patient is now recovering, but no anaphylaxis. This is government guidance of the vaccine priority groups. And as you can see, age is one of the driving factors. Health and social care workers and those clinically extremely vulnerable are also getting the vaccine at the moment. And myself and Dr. Adeel have already been vaccinated. Alhamdulillah, I had mine on the 5th of January. It was, alhamdulillah, one of my easiest vaccine experiences. Some of my colleagues have had a little bit of injection site pain, and that seems to sort itself out within 48 hours. So the three main things which we are cautioned against are injection site pain, fatigue, tiredness basically, and headache. Usually resolves within 24 to 48 hours. What was your experience like, Dr. Adeel?
I, to be fair, didn't have anything, just probably a few hours of a bit of irritation on the site where I had the injection. So I had a Pfizer vaccine as well, almost 3 weeks ago now. So the second one I haven't had yet. So probably we have to wait for another few weeks for that. But the first one was quite smooth and well. So thank you very much, Dr. Samira. The vaccine itself, the good news, obviously, you've heard all the bad about COVID, and sadly, those people we were lost, we're not going to get them back, and we can pray for them. But the end is at sight, and in Birmingham, the vaccination campaign, like other part of the country, has already started. You probably would know someone who's already been vaccinated. Well, you know 2 people now, but I think among your friends and relatives, you probably would know someone. Birmingham has been in one of the top areas in the country where vaccine has been happening. So how to get vaccinated? So you basically would get a letter. Sometimes, if you're lucky enough, you'll get a phone call, but most of the time it'll be a letter which would invite you to your nearest place. So health workers and the priority groups we've shown you before. So today you must have heard in the news that they've gone to the 2nd and 3rd priority groups. So most people above the age of 70 and people who suffer from vulnerable diseases would start getting the vaccines now. So in Birmingham, so far, these are latest figures, 350,000 people have been vaccinated so far in Birmingham and Solihull. So 25 GP hubs and 6 hospital hubs are the center where vaccinations are happening. Hospital hubs are mainly for healthcare staff and people who work in healthcare industry and social care. But the GP hubs are mainly for general community itself. Millennium Point, it's a mass site where you can actually, if you fall in those criteria, you can directly book online the vaccination yourself. GPs are visiting care homes, and people who are housebound, the service will be visiting them in the houses. By the end of this week, some local pharmacies would be starting the vaccination as well. And when you get a letter, there will be actually choices available for you in the letter to choose. But this website is handy to note, Birmingham and Solihull COVID vaccine.nhs.uk. So that's the vaccine where you can get the latest information in the local area. And when your number would come, it will give you a rough idea on how to book for the vaccine or the guidance about the local center. So you'll get more information through this handy website. Next, please. So, well, that's mainly for the vaccination. So we're going to the Q&A a bit from here onward. So, Brother Kamran, do you want us to continue, or you would like to go to the questions? So, sorry, you mute.
Sorry, if you go to the myth busting, and then after that, I'll go to the questions.
That's one. So these are a few of the myth-busting slides which Bima prepared. There are actually loads of them. They're available on our website, but these are some of them which you can have a quick look. So some people say COVID is no more dangerous than flu. That's actually not correct. COVID kills 10 times more people than flu, and that's actually evidence-based research. The data is available. So claiming that COVID is no more dangerous than flu actually trivializes the whole situation, and this has actually already caused quite a bit of harm. So other thing that COVID vaccine causes irreversible side effects. That myth started from one of the videos we've seen circulating around on the YouTube. So no patient so far, I mean, more than 30 million people have been vaccinated across the world. No patient has so far suffered from irreversible side effects in trials or in the general population. So people actually read some CDC guidelines where they said that the CDC presentation where they said that 3,000 people have suffered from temporary and reversible side effects. But this word reversible somehow in the myth it translated into irreversible. So all medicines do cause side effects, like Imam and Sister Salma mentioned earlier as well. And the side effects of these vaccines, they are quite well documented, and we are learning more as well. But saying that vaccines have caused irreversible side effects at the moment, there's no data supporting that. Next, please. So, well, GPs are making a lot of money from COVID vaccination. So I can tell you that we are not. Alhamdulillah, we do make money from there are plenty of other sources for us to make money. So we are paid, GPs are paid £12.50 per injection. And this is NHS pays GPs for their services anyway, even for your other normal vaccinations. So this is kind of non-profit service where GPs for this £12.50 7 days a week, you'll be getting vaccinations, the venues, hall, libraries, equipment, admin and nursing staff, training staff, educating. You can do your numbers. So even if you are vaccinating 500-700 patients in a day, you'll hardly balance. So yes, no one's making profit out of it. Deaths are being exaggerated again. If anything, they are a bit underreported. However, where the misconception sometimes arises that yes, most of the deaths which are reported are the ones which have COVID test positive on the death certificate. However, initially, when the tests were not as widely available, if someone dies and they have a very typical signs and symptoms of COVID and they have died and the test was not done, they would still be included in the COVID death in the initial stages. But now the tests are so widely available and most of the deaths are obviously happening this time. So and they are within 28 days. So if someone dies with COVID and they're after 28 days, they're again not included. So this number of 90,000 almost, which you see in UK, it's actually more careful estimate rather than exaggeration. And next one, please. Vaccines contain aborted fetal cell. Again, that's not true. So what basically happens, people who make these myths, they mix some of the truth with the conspiracy, and that's where these things come up from. So the vaccines which we are currently using, Pfizer and Moderna has been approved there. None of them have got any of these cells, and AstraZeneca. However, in the past, they've used aborted fetal cells which were done in 70s in the virus development phase, in the vaccine development phase. But the final product does not have any of these fetal cells. But in these current vaccines, obviously none of these things are available. Then another myth that vaccines are unsafe. Look, that's why they have not included pregnant women in the trial. Well, pregnant women actually and children are not included in any trials. If you look at a British National Formulary, most medicines, even which we routinely use in pregnant women, the manufacturers recommend not to use it because they're not used in pregnant women are not part of these general trials. However, the recommendation still is that the decision has been left on the doctors, and if the doctor feels that a pregnant woman is at much higher risk because of COVID or because of her immunosuppressant, her immunity is low, then the vaccine may still be given to her. But manufacturers have not recommended it because it's not ethical to use children and pregnant women in the trials. Well, in the questions we can answer more about these, and we've got Imam Sahib obviously to answer this question about halal or haram. But we have got declarations from various scholars all over the world that the vaccines are halal. The other question, which is quite often people ask, and actually some of the people have already asked this question today as well, the vaccine was approved too quickly to be safe. Well, the speed of approval was mainly due to cutting red tape rather than cutting corners. So that's something which you need to remember. But the actual reason why it was done quickly was there's unprecedented worldwide scientific collaboration. And the governments and all the funding behind that, the scientists all over the world. So that's what increased the speed, and thanks God for that. We can't obviously afford to have that. So thanks to all those scientists and everyone who's put their days and nights to get this quickly developed. And the approval phase was shortened because the MHRA in UK, they actually followed from the phase 1 trial, they were following it. So normally all the trials would finish and then the data would go. This time they were following these development from the phase 1. So it was quite easy for them to look at the data when the final phase was complete. It doesn't modify your DNA as well. I'm trying to go a bit quickly here now. So these are mRNA technology vaccines, and it teaches your cell to make proteins that triggers these immune responses. Actually, the actual vaccine would be out of your system within a matter of days and weeks, and it's your body's own immune system that would fight the virus. So like Dr. Samira mentioned earlier, this is the message basically, that COVID-19 is a killer. Do not underestimate it. So all the social distancing and all the guidance you've been given by the government, please follow them. Seek information from the trusted sources, and trusted sources are not just BIMA doctors. We are available, and you can contact us anytime. We've got our email addresses posted on our on BIMA website. You can email there. But actually, trusted bodies, they're regulated, well-regulated, trusted bodies, which you can approach as well. But at the end of the day, it's your decision. No one's going to force you to take vaccine. Like no one forces you to make any other decision. We face this decision every day where we want to admit patient to hospital and patient refuses. So we give them the careful advice and let them make the decision. So we're happy to take your questions from here on. And thank you very much for listening patiently.
Okay, thank you very much, Dr. Adeel, Dr. Samira, really informative. Adeel, can I suggest that in the chat section, you just put in the BIMA website details where people can have access to the resources that you guys have created and also the myth busting. We've got lots of questions to get through. The panelists have agreed to go over time a little, so I can get through as many questions as possible. I'll ask everyone to keep your answers short, please. And we have got a selection of questions related to all of our panelists. So the first one I'm going to put to Hafiz Ather, which is around the ingredients. You know, I'll ask two questions in particular. So one of the questions are we allowed to have the vaccine as is not halal and it contains prohibited ingredients, if it contains prohibited ingredients or chemicals? And the other question is, one of the ingredients is ethanol. Is this allowed?
Bismillahir Rahmanir Rahim. BIMA have made it clear that the ingredients are halal. So this goes back to the example that I gave at the beginning. If a person tells you that Qibla is in this direction, you have to perform salah in that direction now. Now, morally and religiously, now, you're not going to be held accountable for that on the day of Qiyamah. The responsibility lies with the people who told you that direction. So in this situation here, BIMA have done a wonderful job, both morally and religiously, in the sense that they've lifted the responsibility from the Muslims. So on the day of Qiyamah, there will be no punishment for taking, if it is in that sense forbidden. Second thing, and again, it goes back to what I said at the beginning, is that the authority, the people who created the vaccine, the people who are experts in this field, they have told us that it is halal. The evidence to suggest it is not halal is not sustained, it's not proven. It's just qila wa qala, there's doubt surrounding that. So again, it goes back to what I said at the beginning, that shak alone, doubt alone, is not strong enough to override yaqeen. So religiously speaking, the BIMA have done us a great favor by lifting the responsibilities from us unlearned and ignorant people, basically. So we won't be held responsible for it, even if we were to say that by yaqeen, for sure, we know that it is haram. Then when we are faced with a situation which is going to cause harm to our health and cause death, which is quite obvious in this case now, then even the impermissible in our religion becomes permissible. There is a simple rule in Sharia that al-mahzurat tabihu 'inda zarurat, that even the forbidden becomes permissible at the time of necessity. There is no greater necessity than saving your life. This is the greatest amana from your Lord. The soul that he gave to you, it is not yours to tamper with and decide whether I take this or not. We need to take responsibility on this. So whichever angle you look at it, from a Sharia perspective, from a Tasawwuf perspective, from a Sufi perspective, this argument, I don't think it has much of a leg to stand on.
Okay, thank you, Hafsa. Okay, my next questions are for Dr. Adeel and Dr. Samira. And we've had quite a few questions around fertility and pregnancy and what it means for women. And so in particular, I mean, one questioner says that there's been a suggestion that the vaccine can affect fertility and potentially have a negative effect on women of childbearing age and their babies. Is this correct? What advice would you give? Whilst others have, somebody else has asked, is it true that women trying to conceive should stop trying until 3 months after the vaccine? And then also we've had one from someone who's 7 months pregnant asking whether she should take the vaccine.
Sister Samira, do you want to take some of these?
Sorry, Dr. Samira, you're on mute.
Right, good. Right, thank you for those questions. Actually, I was hoping to actually elaborate more on them. So with regard to fertility, at the moment, there is no data to suggest anything and that it affects fertility. In fact, if anything, the effects of COVID can actually be more severe in women in the 3rd trimester of pregnancy. And that brings us on to the next question about whether or not somebody who's 7 months pregnant can take the vaccine. The answer is that at the moment, the guidance is based on a risk-benefit basis. I know people who have been advised to take the vaccine, who are in their final semester of pregnancy. And the worry is, one of the reasons justifying it is because COVID in later stages of pregnancy puts a greater strain on the lungs, which are already under a certain amount of strain because of the advanced stage of pregnancy. Now, it's not the Royal College of Anaesthetists, it is a report published by an anaesthetist responsible of ITU admissions, who have said that there seemed to be a greater proportion of pregnant women in ITU this wave compared to the first wave. So that is therefore very much what's prompted this advice towards a risk-benefit decision. Does that answer the question? Do you have anything to add, Brother Adeel?
Yes, regarding these fertility issues, actually we are aware about these rumors. They've been going on for a while, and not just this vaccine, even the vaccines before as well. The issue of fertility, actually we've been hearing this for the last 10-15 years. This specific issue about this vaccine, it started from one of the person who started in Germany. We actually have got a detailed document about this fertility conspiracy and myths linked with the vaccine. And actually, I've just written a link on the chat, medscape.com. You can go there and read about the fertility rumors, and you'll know more. But at the moment, like how Dr. Samira said, there's no evidence that fertility is linked with this vaccine. And those pregnant ladies who are listening to this, or if you know any, and if you're worried about this, you can discuss with your own GP. They'll be able to give you an individual advice, because with pregnant ladies, it can't be a general advice about all of them. Everyone needs to have an individual advice where you can contact your own GP. They know your medical notes better. They'll look at it and they'll be able to give you better advice whether you are suitable for vaccination or not.
Thank you. There's been a number of questions about the difference between the AstraZeneca vaccine and the Pfizer vaccine. I will direct everyone towards the BEMA website, where it was highlighted in the presentation, where they answer the various questions. Dr. Adeel has also already put that in the chat. Salma, this next question is for you. You touched on this about the indemnity. Someone's asking, can you tell us a little bit more about the immunity or indemnity that's been given to pharmaceutical companies? Why have they been given immunity, and who will be held responsible if something terrible happens?
Okay, well, just as far as I know, as with other vaccine manufacturers, the current COVID-19 vaccine manufacturers have also been given indemnity. So it's not unusual in terms of how vaccine manufacturers are treated. The rights and wrongs of that, I think, are not for me to say, although, I think I've already expressed that I don't particularly like that situation, although I can understand it. But what I do know is that that doesn't mean that the risk may not be taken on by the manufacturers, but it actually ends up being taken on by the state. So the National Health Service is in effect taking that risk in terms of having to deal with any fallouts. And on a financial level, what I have seen is that that there is a protection of £120,000. That's the figure I've seen, but that there could be more updated figures on that. But for me, that isn't a reason to be more skeptical, because that would mean that the same argument applies to all other vaccines that we take up, whether it's measles or polio, the inoculation procedure, or indeed what happened with smallpox. So this was a deal that the vaccine manufacturers had come up with decades ago. It's not something new and somehow more inherently sinister to do with COVID. So I think to kind of mix those two issues up is a bit different. I mean, it's the whole argument around the pharmaceutical industry and how they make their profits and where the patents go, for example, and the fact that third world countries are then disproportionately impacted. So there's a whole kind of economic policy argument to be had. But in terms of the context here about the impact, about the safety and the repercussions for that, for me, they are two separate issues. And I think the fact that there is always ongoing information being shared, not just nationally, but internationally. So all the cases that you're hearing about, even the most mild side effects, as it were, have to be chronicled, they have to be recorded. And again, something that's happening at this mass scale with the social media access that we have, that I have no doubt that there cannot be some kind of hiding of information. Even just now in the last couple of weeks alone in this country, we've had millions, of people being vaccinated. So if, and God forbid there is an issue, we will find out very quickly. It will not be because something underhanded was done. I think there are the only thing I think guaranteed in this life is death. They say taxes, and even that some people can avoid. But I think other than that, we have to be about weighing up what risks are and doing so in an intelligent and balanced way.
Thank you, Salma. Just some questions for Hafiz Ather. A question. Some people are having a wait and see attitude to the vaccination. What is the Islamic perspective on this? If I wait whilst others try, am I sinful?
I think, religiously speaking, the Prophet ﷺ made it abundantly clear that we should love for others what we love for ourselves. And I hope that answers the question. I think it's a selfish attitude to have. If Allah subhanahu wa ta'ala, and let's remember that Allah is the ultimate provider of cure. If He has provided a means of cure, then we should take that. We shouldn't have that wait and see attitude. We should have full trust in our Lord. We should have full trust in the people of authority and leave the rest to our Lord. So I don't think so that's the kind of attitude that we should have. Our Prophet ﷺ taught us to be selfless rather than selfish. And he certainly showed that through every single aspect of his life. So in these times of difficulties, it's an ideal opportunity to resort back to the sayings and actions of our Prophet ﷺ, who is a perfect example for us.
Okay, thank you. Dr. Adeel and Dr. Samira, we've been having questions about people who've tested COVID once or twice. Do they need to have the COVID vaccination? And also, will the COVID vaccination be an annual vaccination similar to the flu jab?
Okay. So I think I'll start with this one, Dr. Adeel, if that's okay. So with regards to having had COVID before, whether or not you need vaccination, the problem is that at the moment, we do not know how even natural immunity, how long to COVID after being infected lasts. So one may be lucky first time round, don't know how long your antibodies linger around. Some people say 60 days, some people think it might be 90, some think it's even shorter. And likewise, we don't know how the rest of the immune system would be able to fight COVID for what duration of time. So the answer is, you don't know how long your immune system memory would last after the first time you've had COVID, and therefore it shouldn't necessarily preclude somebody from taking the vaccine. The second question, what was it? Sorry.
So if you need to get your yearly boosters, basically.
Okay, I think at this stage, we don't know. And the government and the scientific body really are still reviewing data and trying to reach an evidence-based decision.
Yeah,
Is there anything else you'd like to add, Dr. Adeel?
That's exactly right. With obviously viruses, we get to know them a bit more with time. Some viruses that mutate really quickly, you might need to get the boosters on regular basis, like we do with the flu vaccine. But others that do not mutate as much, you might need 1 or 2 boosters, and that might cover you for the rest of your life. So some of the childhood vaccinations which you get, they are against certain viruses, and they cover you for life. But the flu virus, which is a different, obviously these are different types of viruses, you get the vaccinations on yearly basis. But with time, we'll know more. With time, we'll know whether we'll be able to combine all these vaccinations into one, so that you'll be able to get them regular. It's too early to tell. At the moment, we need to complete this course so that we are all immune. For how long that immunity stays, the science is debated for.
Okay. And whilst you guys are here, a question which has come up, which has also been on my mind too, is you mentioned in your presentation around a fetus being, the vaccine being derived from fetus, but it doesn't contain fetus cells. What does that mean, that it's derived from fetus from the 1970s, but it doesn't contain that now? Dr.
Adeel, I'll pass on to you.
Oh, okay. Well, yeah, I think I did rush through that issue. It wasn't derived from, the vaccine was not derived from the fetal cells. Basically, what happens is that, I'm not a virologist myself, but the virologists in BIMA have told us about this, that when as a part of vaccine development, you need to grow virus in certain living in certain cells. To look at their interactions and stuff. So as a part of the vaccine development process, these companies, they've got these cells, fetal cells. So fetal cells are the fetuses which have been through abortion. And these are the old ones which went through abortion in 1970. It wasn't, I mean, abortion is something which is fairly common, which unfortunately is the reality of life. So they took, actually for AstraZeneca, I emailed AstraZeneca myself about this issue, and I got a direct reply from them. So they said that the fetus aborted in 1970, some of the kidney cells have been used when the research is happening for the vaccine development phase. But once the actual, the research is completed and they know what type of medicine it is, at that time, the fetus or fetal cells or any animal cells are not used in the vaccine development process or in the vaccine preparation process. So the actual product does not get any of these fetal or animal cells. But when you're doing the scientific research at that time to grow the viruses or to check different interactions, you use these fetal cells. But it's wrong to suggest that the vaccine have got fetal cells or any of the animal products and then tell people not to take them. So this is not the case.
Thank you. I do want to sort of bring this session to an end. And I appreciate there's so many questions here and so much more that people have very genuine questions. But 1 hour is never enough and one session is never enough. But what I want to do now is hand over to Hafiz Ather to just spend a couple of minutes to have the final words before I just sum up and bring the session to an end.
Bismillahir Rahmanir Rahim. I just want to share my own thoughts over the last 12 months and indeed over the last few years. I've always said this, but I think the pandemic has brought this home and it's now instilled in my head. I'm convinced now that today our problems, they're not political, they're not medical, they're not economical, they're not social. Most of our problems today are spiritual. And I think this pandemic, if we look at it holistically, and if we just take a moment with a clear head and just reflect on it, I think a lot of people will appreciate that this is the reality. And if the problem is spiritual, then it means the solution lies in the spiritual. And I really want our Muslims, the vaccine aside and everything aside, just the whole pandemic as a whole, just to reflect on that. It's the spiritual qualities which will get us through this. And the spiritual qualities, as a reminder, taking responsibility is a cure. And that means wearing a mask. It means keeping a distance. It means protecting the NHS, staying at home. Responsibility by its very definition is a spiritual term. The cure is sabr and shukr. It's staying patient. It's being grateful for what you have. The cure is not in scapegoating. It's not in focusing on others. It's not on, no matter how bad they've handled it or how well they've handled it, looking at the government, finding someone to blame. Our Prophet ﷺ never indulged in scapegoating. Sabr and shukr by its very nature will get us through this pandemic. Sabr and shukr are spiritual terms. Certainly, the cure in all of this is to stay positive, never to despair on the rahmah of Allah subhanahu wa ta'ala, which for certain is haram. Allah says in the Quran, La taqnatu min rahmatillah, never despair on Allah's mercy. The cure is not in forwarding messages of doom and gloom, where you don't know what the source is, where you don't know what effect it will have on the other person who receives that message. Staying positive is the answer. No one possessed this beautiful spiritual quality more than Sayyidina Muhammad sallallahu alayhi wa sallam. So everything, whichever angle I look at it, whatever I've been told to do, boil it down to its bare basics, they're spiritual solutions. And certainly, I think the solution, and we've missed this a lot, and it's my duty to inform our people, may Allah give myself the tawfiq first and foremost, is that the cure for this lies in the forgiveness from Allah subhanahu wa ta'ala, to do his zikr, to pray to him in abundance, and to really, we know that our arch enemy is no one but shaitan, and to really to seek forgiveness and seek protection from Allah subhanahu wa ta'ala. In all of what we've said, in all of the experts that we've had who have explained this issue wonderfully, and we've given a really fresh perspective from Sister Salma Yaqoob, ultimately it will boil down to one fact, that Allah subhanahu wa ta'ala alone is your cure, that no vaccination will work without his will. So in this difficult time, we take inspiration from Ashab Kahf, we take inspiration from the stories of the Quran, who whenever they faced difficulties, they always resorted to Allah, they invoked his mercy, and they sought humility in everything they do. The one thing I've seen in the last 12 months we've really, really lacked is humility in our reaction, in our post, in our social media. And I think the day that we show humility as a society, as a community, I'm quite convinced that inshallah ta'ala this problem will be over. And I pray that inshallah ta'ala Allah gives everyone shifa from this horrible disease. Ameen.
Thank you so much, Hafiz, for that beautiful spiritual reminder and a fantastic way to end this webinar. That ultimately everything comes from Allah subhanahu wa ta'ala. I'm really, really sorry. Please accept my apologies to everyone whose questions I couldn't get through. You know, this has been an informative session for me, and I'm sure it has been for those that have been listening to. And it's also generated conversation in the chat section. You know, positive, negative, everyone has the freedom to free speech. I can assure you we're not being paid to say anything, and nor are the imams. Everyone's doing this, you know, saying what they think is best. I can assure you mosques, imams have been at the forefront of COVID safety measures. I've witnessed myself. In fact, a lot of us mosques who don't normally always work together have worked so well together during COVID, and may Allah subhanahu wa ta'ala continue to make that happen. I'd like to finish by thanking our guests for taking out their precious time for us, and for their guidance, for the community, and indeed our audience for sending in their very relevant questions. To our listeners, as I said in the beginning of the webinar, it is essentially your choice, but I hope you now are better informed to make that choice. But also do your research. You know, 1 hour is never enough. But also remember, tawakkal, have faith in Allah subhanahu wa ta'ala. So I end by just saying to you all, please continue to be safe. We're still in the midst of a pandemic. Whilst we ask you all to mask up, regularly wash your hands, maintain social distance, please don't forget to keep an eye on all those who are struggling during this difficult time. May Allah subhanahu wa ta'ala bless you all. Assalamu alaikum, and inshallah see you all soon. Jazakallah khair. Assalamu alaikum.